Let's outdo yesterday. Talk to a doctor about migraine treatment options at PfizerForAll.com.
Just when I think I can't love Pfizer and Albert Bourla anymore, they come up with the perfect product. Pfizer. You don't get enough access to their products, do you? You've always got to deal with mediators and brokers like doctors and pharmacies, etc. Well, I've had enough of it. I want Pfizer direct to me, especially when we know that Eli Lilly and Pfizer are so rigorous with their testing, so diligent with their products that there are hardly any incumbents of Chinese concentration camps that aren't given their products as a test. It's indeed true that major US pharmaceutical companies have been running clinical trials at hospitals affiliated with the Chinese army and may have tested drugs on prisoners in China's illegal concentration camps. Isn't it amazing that during the pandemic period, we were given a clear moral and ethical choice? You better take this vaccine, if not for yourself, you selfish pig, then for your grandmother, or for the elderly, or for the vulnerable. Well, these very same corporations ran clinical trials in illegal concentration camps, while we were being told that it was racist to inquire as to whether or not the virus had emerged from Wuhan, most likely a Wuhan laboratory. We were told that it was racist to say that. They were running clinical trials at concentration camps. What kind of warped and crazy moral metrics are being deployed where you are called racist saying, I heard this thing came out of Wuhan. Do you think it's possible it came out of the Wuhan Institute of Virology? You racist. Now, what is going on in China, though, is we're running clinical trials on prisoners in concentration camps that are illegal. Many of you will be familiar with the plight of the Uyghur people, a Muslim community who are incarcerated in China. A lot of people campaigning for their freedom. Pfizer teams have got a totally different perspective. A bipartisan group of lawmakers has sent a scathing letter probing the FDA for more information about decades of research from companies like Eli Lilly and Pfizer. Some of this research was conducted in the regions where the Chinese Communist Party has been accused of setting up camps to house and commit genocide against Uyghur Muslims. The representative said, we believe that US biopharmaceutical entities could be unintentionally of course, intentionally all they do is heal you and help you, profiting from the data derived from clinical trials during which the CCP forced victim patients to participate. Eli Lilly told the Daily Mail, that's a British newspaper, Lilly conducts clinical trials around the world to ensure diversity in our research and increase access to our medicines. What a brilliant response from their PR team at Eli Lilly. Diversity in our research. You could be that one of them little children that you saw spasming in America having been given a vaccine. I believe that was a Moderna vaccine, but I wouldn't absolutely commit to that, certainly not while we're on YouTube. But we also run clinical trials on prisoners, potentially Uyghur prisoners incarcerated in China. Well, there's no reason why you should wait till you're incarcerated in a Chinese concentration camp to try Pfizer's latest products. Albert Bourla wants them accessible for all. Pfizer for All has launched. Here's an Albert Bourla post on that. Research shows that many people in the US are overwhelmed by the abundance of online health information. I'm so overwhelmed. Some people are telling me that adverse events need to be investigated. Some people are telling me that excess deaths need to be investigated. Some people are pointing out that athletes appear to be collapsing on the field of play with an incredible and alarming regularity. Other people are trying to really push Pfizer down my throat or into my arm where the spike protein definitely won't migrate into the lining of my heart. Especially when they're ill, they have questions, these people, and need to make, I'll do it in an Albert Bourla voice, it will help, and need to make the best decisions for themselves and their loved ones. So I'm thrilled to announce the launch of Pfizer for All, a user-friendly digital platform designed to simplify healthcare access and management for patients in the US. Patients can use Pfizer for All to connect with qualified healthcare professionals the same day, get prescriptions and diagnostic tests sent directly to your home or for pickup at a preferred pharmacy. Well, this is what a brilliant opportunity. Look at this. We're proud to call the US our home home since founding in New York 175 years. We started Pfizer with just a couple of rickety old vaccines 175 years ago. We're committed to helping patients and Uyghurs as well, it seems, although there is no concrete evidence that the trials took place in concentration camps, just in the regions. And is it beyond their moral purview? That's something to investigate. Let's have a little look at Pfizer for all.
Yesterday was amazing. Rachel was determined to live her life on her terms, not her migraines. Because after years of coping, Rachel took the next step to find an option that could work for her. Yesterday, breakthroughs were made and lives were changed. But that was yesterday. Let's outdo yesterday. Talk to a doctor about migraine treatment options at PfizerForAll.com.
Pfizer for all. Here's a reminder about some of the other Pfizer products. This is from 2021. Today, with our partner BioNTech, we announced results from a phase 3 trial in 12 to 15-year-olds that showed that our COVID-19 vaccine demonstrated 100% efficacy against COVID-19 disease, robust antibody responses, and was well tolerated. 100% efficacy. Is it possible that that would be considered misinformation? 100% effective? Let me know in the comments and the chat how you feel about that. Also, it seems that Paxlovid, their oral COVID medication, wasn't as effective as they claimed. A new study seems to suggest that it doesn't actually work. The time to sustained alleviation of all signs and symptoms of COVID-19 did not differ significantly between participants who received nirmatrelvir or Paxlovid, to give it its brand name, and those who received the placebo, New England Journal of Medicine journalist today. In rolling out Paxlovid, Pfizer claimed in a press release that its preliminary data showed an 89% reduction in hospitalization and death for patients who took the pill. When Paxlovid first hit pharmacy shelves, Pfizer claimed that Paxlovid rebound, that's short for people's symptoms coming back after taking a course of Paxlovid, was inconsequential, amounting to 1 or 2% of patients who were prescribed the drug. But a late March study suggested that about 1 in 4 patients on Paxlovid suffered from that rebound. This study didn't just analyze the presence of viral fragments. It found that 24% of enrolled patients suffered from symptomatic rebound. So it was about 25 times more ineffective than they claimed. So, whether it's testing prisoners in Chinese prison camps, whether it's reaching you in new ways, making claims that 100% of their vaccines are effective for children, or claiming that Paxlovid is 25 times better than it actually is, Pfizer has got something for everyone. And most of it is, well, I don't know, just make sure that you're looking after the lining of your heart. Won't go too far because we're still on YouTube. We can't continue to bring you this beautiful content without the support of our partners. America, listen up. First, a massive COVID-19 spike with 1.29 million cases reported daily. Then the World Health Organization declares monkeypox a global health emergency. What will they do next? Well, apparently it's going to be a bird flu summit. These aren't just coincidences. It seems that they're calculated moves to keep us fearful and controlled. Would you agree? Were you prepared for the last pandemic? 48% of Americans don't have any emergency supplies ready. We saw how the medical and pharmaceutical industries failed us last time. Are we going to count on them again this time? It's time to take control. Get the Contagion Emergency Kit from the Wellness Company. It's packed with ivermectin, hydroxychloroquine, Z-Pak, Tamiflu, and budesonide, and a nebulizer. The treatments they apparently didn't want you to have. A few clicks, and this kit will be at your door. Act now, protect your family, be proactive, and be prepared. Order your Contagion Emergency Kit today. Visit twc.health/brand. Use the promo code BRAND at checkout to save $30. That's twc.health/brand and use the code BRAND to claim your discount. These kits are limited and only available in the United States of America. God bless America. Hey, thanks for watching. If you want to see more uncensored content where free speech can flourish, join our live stream. Click the link right here to watch the next video if you want to, or become a member of a growing movement. Download the Rumble app and you'll be informed every time we make a new piece of content. Stay free.